Good morning, good afternoon, and good evening. I'm Rob, the Fuzzy Carnivore, and today, this isn't going to be a movie or TV review. In fact, I'm going to change the direction of this channel a little bit. I'm still going to do those things. I'm still going to do those things a lot. But I'm going to have a little bit more lifestyle topics. But with the title of this video, you're going to have to continue watching to find out what's going on. So I've been watching a lot of videos posted by different people on YouTube, and it got me really thinking about my own health. And that topic is on male hypogonadism, or just low testosterone. And I would listen to these guys talk about all their symptoms and everything that they were feeling. I was like, man, that kind of sounds like me. So let me talk to my doctor about this. And I convinced her. I told her to test me for low testosterone. And surely enough, I came back with low testosterone. The average, it differs depending on what doctors you're talking to. But the target area for your testosterone is anywhere between like 300 and 1,000, or 300 to 800. When I got tested, I had 191.25, which is pretty low. But what led me asking the doctor to get me tested? So if you do your own little research and watch videos like I have, low testosterone has a plethora of symptoms to look out for. Mood swings and depression, increased body fat, loss of muscle mass, memory and cognitive behavior issues, decreased sense of well-being, fatigue, and a decreased sex drive. And pretty much all of those symptoms I've been exhibiting for the last 2, 3, 4 years. I don't even know. Like, it's just been a long time. And I've been one that's been completely against taking mind-altering antidepressants because I want to be here. I want to be present. I don't want to feel numb to everything. And that's my perception of those. And you know what? Sometimes those things are the exact thing that somebody needs to get through the day. But that's just not how I want to live my life. That's not how I want to feel throughout the day. So I asked the doctor to test me. I told her I wouldn't take antidepressants. But came back that I did have low testosterone. But what am I doing to treat it? So there's a whole bunch of different treatment options. There's pills, but you got to watch out for those pills messing up your liver. Don't really want to do that. There's a gel, and that's actually the way I'm going right now because of work issues and social life issues. It's really putting a damper on my social life. It's throwing off my schedule because you're supposed to take a shower before bed so that, your spouse or your loved ones don't rub up against your gelled areas and increase their own testosterone inadvertently because it's transdermal. So that's going to end up switching. I'm not going to be able to do that for much longer. But that's the way I'm going right now. So I do one pump of gel in each hand, and I just rub it over my shoulders and, let it dry, put on a shirt, get ready, go to work. There's injections. That's going to be your most common way and the way that is more controlled as far as getting the right amount of testosterone into your body. There's little pellets that are time delay that last for a couple months, and then you get another pellet put in. There's patches. That's not really the way I want to go, I don't think either. It wasn't even brought up when I talked to my doctor. There is a dissolvable type pill that you can put in your mouth. That wasn't brought up. I'm not sure about the efficacy of that method. So I got tested almost 4 weeks ago. I'm on week 3 of my treatment. Honestly, I can't really say one way or the other as to whether I feel 100% better. I don't even know if I feel a little bit better. It's really I'm really not feeling any real big side effects. There are negative side effects to testosterone, but you're going to have to check those out yourself. Do your research before you take any meds. Just trust me, that's what you want to do. Take your health into your own hands, because your doctors will look out for you, but really you need to be looking out for yourself and making sure you get the care that you need. I'm going to keep on making these videos from time to time, give you all updates on what's going on, what treatments I'm using, if I'm noticing any, results. One thing I can say, I'm overweight. I'm 275 pounds when I started all this. I've also been taking a weight loss medication that was prescribed by the doctor to try and get my weight down. But I've also been hitting the weights and lifting pretty heavy at the gym. So I think I'm starting to see a little bit more muscle definition. I've seen about an 8-pound drop in the last 3 weeks, which is really good. That's right on par with where it should be. I was kind of hoping that it would be a little bit more drastic, but it wasn't. But I'm good with what I'm losing right now. It's a healthy weight loss, and that's where I'm going. Hopefully I can get all my body back in order. I'm really not a fan of how long I'm waiting in between starting the treatment and testing my testosterone again. I don't have another doctor's appointment for about a month and a week. So about 5 weeks from now is when I'll be taking another blood test for testosterone. So I'm not happy about that. I could probably, go in there and ask to be checked again. Probably should, so that we can get dosing right. And this is going to be a journey once you start testosterone. From what I've seen and researched, this is probably going to be the journey for the rest of my life. It is what it is. Military men are usually more prone to getting this for some reason. I don't have the science to say what it is, but I've talked to a couple of my Marine Corps buddies, and they also have low testosterone. And guess what? Socialized medicine TRICARE doesn't cover it when you're in the military. Doctors won't even prescribe it to you. So you got a health issue, and you can't get the treatment you need. So what do? You go out of pocket and you look elsewhere, which is really, really jacked up. My doctor was willing to work with me. Hopefully she continues to want to work with me to try and get my levels to where I want them to be, up towards the middle/high end of normal. And hopefully most of my symptoms will go away. Hopefully I won't have any negative effects, but we'll see. This is my journey. If you got any questions, I'll answer them the best I can. Leave them down in the comments. That's really all I got for you. Whether you want to see this type of content from me more or not, I'm going to be posting it. This is my journey. Hopefully it'll help one, two, if anybody, find out what's going on with them and, help them medically. Other than that, stay tuned. Click that like, click that subscribe, leave me a comment, and stay classy.